through the years of homelessness, I went to CMC, and I received care for my back, for allergies. I woke up one day and half my face was just hanging there, and I found out I had Bell's palsy. They diagnosed them all and helped me out through them.
Robert has come a long way since then. Today, he's president of the Community Medical Center Board. After all, good health care helped Robert turn his life around.
It helps clear your mind so that you can make the better decisions and help yourself get out of situations.
Robert's story is just one of many examples of how community medical centers offers a safety net for those in need, providing a vital role in the health of our community.
It takes more than just, an appointment to take care of a kid. It's supporting the family, making sure they have the referrals. Like that baby had open heart surgery, a few days of life. So just having that place that they can come and know, that we'll be there for them.
Me sabe escuchar, sabe escuchar y sabe atender el llamado como papás.
With young moms, just making sure that they're learning to help those kids, reach their full potential.
Dr. Hundle often sees patients that have never had the opportunity to really talk to their doctor.
I get to see a lot of people from Punjab, where I was born and grew up for the first 7 years of my life. And so a lot of them don't speak any English, and so I'm able to provide that extra service for them here. They absolutely love it. And it's interesting because the very first visit I'll have with them will be a very lengthy visit because they've never been able to talk at their appointments before. Everything they've said has been filtered through a family translator or a language line translator. So for the first time, they're able to talk directly to their doctor, and that's huge. And they are very excited about that. So they want to tell me about every little thing that's happened to them in the last 15 years, and I like to listen, so it makes for a long day, but I think it's worth it in the end.
At our dental centers, patients learn the role good dental hygiene plays in their overall health.
A lot of patients, adults and children, some have never been to a dentist before. Some don't even know that it's important to floss their teeth, to come for regular checkups, and that a cavity can turn into something dangerous, life-threatening, with a child having an abscess and no means to have it taken care of. Our providers, our assistants, our hygienists, they're very caring. And the patients, it's one of the things that they tell us, we're so terrified to come to the dentist, because they're in pain. And when they walk out, they thank us, and it wasn't too bad. And now we have them on the road to a healthy dental care.
At community medical centers, we believe in treating the whole person, and that includes mental health.
We have full-time behavioral health clinicians in all our site. We see patients from mild adjustments, losing their jobs, moving, to more severe conditions like clinical depression, PTSD, bipolar disorders, and also having difficulties managing issues pertaining to substance use. So by seeing someone for their behavioral health issues, we feel that once that's addressed, a patient is overall functioning is going to be positive. They're going to be able to address all other facets of their life.
Started as a volunteer effort in 1968, Community Medical Centers has continued to grow in this region, now with 18 locations in San Joaquin, Solano, and Yolo counties, serving the working poor and homeless. 85,000 patients received care last year alone. Community Medical Centers receives funding from Medi-Cal and Medicare reimbursements, federal grants, and private donations. Fees are charged on a sliding scale based on the patient's income. From mental health to primary care, Community Medical Centers is addressing the needs of the underserved, reducing unnecessary trips to emergency rooms, and contributing to a healthy community.
We see almost on a daily basis that, how these young kids that, maybe came when they were little or were born here, parents were farm workers or, homeless, and now they're already applying to college. And, you can see changes in the time I've been here. Things are not easy. I mean, you're seeing kids with heart conditions and, families are struggling, but just being part of that group that supports the community, it just, gives me everything I need to keep going.
Community medical centers, creating a healthy community.